Hi, everyone. My name is Dr. Evka. I'm one of you, almost as mom, and I really enjoy being part of your group. So, hi. Today, you're going to get to see me in a little bit of a different capacity. I know many of you are my friends. I just love you. But you're going to get to see me in a different capacity. I just took a course on the COVID-19 vaccine. I want to share that information with you. So think of me like this conduit that's kind of just bringing you information. Some of this information may change over time just because information about COVID-19 vaccine is going to change. It's a brand new disease. It takes years to figure some of this stuff out. And I also want to let you know that I am not your doctor. Although I am a doctor, I'm not your doctor. I'm just spreading education. That's all of it is. It's education. Some of it is opinion and personal based, but I'm giving you the best information that I have at this moment right now. So welcome to a new place on this deck and to question one. What is the COVID-19 vaccine? So I'm going to try to simplify this answer a little bit and kind of share it as part of the story. Did any of you ever sit down to take a test and notice that the test questions look somewhat familiar? You've seen them somewhere else before. I have. Currently, I'm doing a podcast called The Feeding Handbook, a podcast about children with food allergies or feeding difficulties. And in episode 8 of that series, I talked about the Queen's Gambit, talked about how much I used to love calculus and math and chess. In college, I took so many calculus and mathematics courses, and I started to see a pattern develop. During Calculus 1, people seemed to do so much better on the final exam than they did on any other exam. I saw people who were worried about passing Calculus 1 because I helped to tutor them. I was a calculus student myself, a Calculus 1 student, but calculus was kind of easy for me. So I remember tutoring them on their calculus and remember that they were really worried about how they would do on the final exam. And then they would take the final exam and they scored really, really well. And I pat myself on the back and I said, good job. That must mean that I am doing a great job with tutoring them. Okay, so then Calculus 2 happened, and then this time, because it was Calculus 2, and I was working at a medical clinic, I just did not have time to tutor them. And the students were kind of worried, like what was going to happen during Calculus 2 for them. So they went to the final exam anyway. And I was worried that they were going to do not so well. But guess what happened to these same students? They got almost perfect scores on the Calculus 2 exam. So then I started thinking, well, maybe it's not me who's giving them the perfect scores. Maybe they just know it and are pulling my leg and saying that calculus is hard, but maybe it's not. But we'll see. So then I took Calculus 3, and again, I saw the same phenomena. So in Calculus 3, I saw students who, honest to goodness, were not doing well on any of the prior exams. And they took their final exam and got an almost perfect score on it. What was it? What was happening? I found the Calculus 3 final exam to be harder than the prior exams. And they were in and out of the classroom so quickly with these really good scores. They knew the answers. Well, for me, the Calculus 3 exam was the hardest exam yet. Perhaps it was my time now to be tutored with them. So I went to one of these students. I went to them humbly and said, I don't mean to be rude or anything, but how did you do so well on this final exam? Because I knew they were struggling with it. So I asked them, well, how did you do so well on this final exam? I learn from you? Can you tutor me? The student turned to me and said, Evka, Dr. Evka, did you go to that exam prep session that the teacher gave after hours? I said, no, I did not. The student then whispered in my ear, just go do it next time. Anyway, so next semester, I took Calculus 4 And this time, at the end of the semester, I went to that study session that the teacher offered after hours to help students study for the exam. This time, I paid very closely to that study session. The teacher gave me a list of practice exam questions. She also wrote down how to answer all of them, and I jotted down all the answers that the teacher was giving me while I worked through the math problems myself. I then went to take my final exam, and guess what was on that paper? All of the questions from the study session, and I got 100% score on that calculus for exam. This is a true story. The COVID-19 vaccine is like that study session that the calculus professor offered to the students right before the final exam. The COVID-19 disease is like the actual final exam. It's the real thing. COVID-19 or the actual final exam in the calculus class is real. If you don't pass the final exam, you might not pass your calculus class. If you get COVID-19, you might get very sick. That study session right before the final exam is like the COVID-19 vaccine. It gives your body a chance to prepare for the final exam. It gives you the ability to catch COVID-19 from your environment and not get so sick as a result of it. Prior to attending that study session, I was using all of this hard work and natural talent to pass the exam. I knew that I loved math and that it came naturally to me. I also studied hard for the final exam. Despite all of that, I didn't get that almost perfect score that some of my classmates who went to the study session prior to the final exam got. They didn't have to study or work as hard. They just went to that study session. All they had to do was remember the questions and the answers from that study session. If they remembered all of them, then they would have a really good score on that exam. In the same way, despite how well you eat and how good your health is, you might get COVID-19 and get sick from it, perhaps even really sick from it. If you have worked extremely hard to be in tip-top shape, hoping that it will help you not be so symptomatic, you might still get COVID-19 and find yourself to not be feeling so well. You might wonder why your friend, the really overweight one with diabetes, heart disease, and high blood pressure who just eats junk food, was exposed to COVID-19 over and over and over again, yet they felt just fine. All they did differently is that they got the COVID-19 vaccine. All they did was go to that practice exam session that gave them the answers to the calculus final exam, copied down all the answers, and remembered them. Their body had remembered the messages that they got from the COVID-19 vaccine. They had taken the COVID-19 vaccine. That vaccine wasn't COVID-19. It just mimicked one part, the infectious spike protein part of that COVID-19 vaccine. The body got a chance to study what that one little part, the spike protein part of COVID-19 looked like. It memorized what it looked like. It memorized what it needed to do when it encountered it to be able to be well again, to be able to pass that exam. The body had the chance to preview the final exam, the actual COVID-19 infection, in advance. Thus, when the virus entered your friend's body, the body did not ask, hey, what is this new virus with a spike protein that I have not seen before? What should I do with it? Instead, the body had seen this virus before. It had already memorized what to do to get rid of it efficiently, how to pass the getting rid of the infection without getting many symptoms exam. On the other hand, the people who did not go to that final exam session, that had to work so hard to pass and or to do really well on that final exam. They had to think long and hard about the answers. Some of them had studied hard and had worked hard. They passed the exam. Others were not so fortunate. One more thing. You cannot get COVID-19 from the vaccine. There is no virus within the vaccine. You just wanted to make that very clear. Back on to question number 2. How do the Moderna and the Pfizer vaccines work? Imagine this. You signed up for the COVID-19 vaccine and waited for days or weeks until you were finally able to get it. Now, today's vaccine day at your local immunization center. You go there, show your ID, and stay in line with other people. You're asked to sign a sheet of paper telling you more about the vaccine. Then you gather in a room with other people also waiting for their vaccines. All wear masks and try to stay socially distant. Then you watch a healthcare person come around carrying a tray filled with a syringe. The syringe has a vaccine in it, the COVID-19 vaccine. Now it's your turn to get the vaccine. At this moment, you feel some excitement as you have been waiting for so long to get that vaccine. The vaccine gets ejected into your arm muscle. On a microscopic level, you know that the vaccine is going into your cells. These little containers that provide structure for all living things. Cells take in nutrients from food, convert those nutrients into energy, and carry out special jobs and functions. When the vaccine goes into a cell, it encounters various parts of the cell. It taps one of those cell pieces and says, "Hi, I'm here." That particular piece doesn't just ignore the vaccine. No, that particular piece is a little bit different. It can understand all kinds of languages. When it hears the vaccine say, "Hey, I came to visit you so I could give you a message on how to make something in vaccine speak," that little piece can translate it. That little piece reads the message that the vaccine gave it. It translates that message into English and says, "Ah, I know what your message is. You want me to make spike protein, and your message shows me exactly how to make it." And that little piece thinks, "Vaccine. Since you came all the way here, your message must be very important." Then the little piece of the cell makes the spike protein just as it was instructed to do. Meanwhile, that vaccine that comes to tell the cell what to do dies. It finds the human body to be unhospitable. Within about a week, half of it has degraded, and within another week, well, it just doesn't stay in the body for long. The vaccine was successful in warning us. It told our cells to make spike proteins. Now there are all of these spike proteins within the cell, and they leave the body to explore the world. Again, the spike proteins are just a little portion of the actual COVID-19 virus, but they're the part that the COVID-19 uses to kind of help infect us. And it's the part that the vaccine helps us to create. So let me go through more through this vaccine creation story. So outside the cell, these spike proteins encounter trash collectors who think that the spike proteins are trash. They take the spike proteins to the trash bins. These trash bins have names and are super sophisticated. They are called T cells. Hee hee. T for trash. Okay, just kidding. It's not what the T actually stands for. Anyway, these trash collectors organize garbage into piles to figure out what to do with it. They know that the recyclables need to be recycled and that the leftover vegetables go into the composite pile. They even have a trash pile for things that aren't part of the human body. Spike proteins go into that trash pile, the one pile that is meant for foreign things. However, the T cells need help in figuring out what to do with the pile of foreign things, the pile that has the spike proteins. Thus, the T cells ask other cells in the immune system, like B cells, to come over and take a look at this pile of foreign things that contain the spike proteins. So the T cells tell the B cells, "Please come over. Please look at these spike proteins. We're worried that these spike proteins may do something to the body." So the B cells look at these spike proteins and try so hard to figure out what to do. They say, "Gosh, these spike proteins certainly are squirmy. If we can't hold them down, maybe they can go into cells and they'll want to go into more cells." What happens then? The T cells ask the B cells, "How do we tie these squirmy spike proteins down so that they don't go anywhere?" Then the T cells remember something very special about the B cells. They remember that the B cells are crafty. They like making things once they find something to make.
The T cells tell the B cells, we know how crafty you are and how you like to make all of these contraptions. We need you to come to the rescue and make handcuffs for these spike proteins, the perfect kind of handcuffs that will wrap around these foreign spike proteins in just the right way. The type of handcuffs that will prevent these spike proteins from going anywhere. B cells, they love this idea. They love making things. They make lots and lots of handcuffs for spike proteins. Again, at this point, when you just vaccinated, they just make the handcuffs for the spike proteins because the rest of the virus isn't there. The vaccine just allows you to do this thing with one part of the virus, the spike protein part. So the body makes lots and lots of handcuffs for spike proteins because it doesn't know how many spike proteins there are. This means that if COVID-19 viruses with their spike proteins enter the human body, there are handcuffs there that are ready for them because the spike proteins are part of the COVID-19 virus. The purpose of these handcuffs that the cells make is to help restrain the movements of the spike proteins. And if you're talking about actually having the virus in your bloodstream, they help to restrain the movement of the virus because they hold on so tightly to its spike proteins and hence the virus. The other parts of the immune system can go ahead and then figure out how to get rid of these viruses. If the COVID-19 virus can't go in and out of cells because it's handcuffed, it's not going to create that much damage because it creates damage as it goes into cells, tries to make more copies of itself, goes into more cells, tries to make more and more copies of itself. So you kind of want to prevent the COVID-19 virus from going into cells and doing all this damage. People are not going to get as sick. It's been months since the vaccine was first given to the first patients, and guess where they are now? By and large, these early vaccine takers are not getting sick with COVID-19 because their body already knew what to do with the spike proteins, which are part of this COVID-19 virus, and knew how to hold them down. Immunity is actually holding strong for these early vaccinators, especially from the perspective of these T cells and antibodies, from the perspective of the trash collectors knowing what to do if they see the virus, and from the handcuffs being able to stop the virus from wreaking all of this damage. Especially once you get your second dose of your COVID-19 vaccine and you wait a couple of weeks after that, your immunity to future infections goes way up. Okay, the next question, and you're getting at a different part of the deck. It's still construction zone. We're not done, so you still see a lot of pieces here. But I wanted to, again, move to a different environment for the next question. So the next question is, if your child's teacher gets vaccinated against COVID-19, can they still give you COVID-19? And I think that's a great question. We don't have all the data yet on the two new COVID-19 vaccines, the Moderna one and the Pfizer one. Why? Because the vaccines are brand new and COVID-19 is a new disease. It will take time to figure everything out. When the manufacturers were testing the virus, they asked, how well can the virus stop people from getting really sick with COVID-19? They didn't quite ask, how well can the virus stop people from giving COVID-19 to others? Now, over 5 million people have gotten the vaccine, and we'll see over time how well the vaccine protects people from spreading COVID-19 if they have minimal or no symptoms. We do know that the vaccine prevents around 95% of people from becoming significantly symptomatic with COVID-19. The vaccine helps to prevent symptoms, 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 and especially after you get that second dose. However, the vaccine also does something else that's amazing. It helps the body to create just the right kind of handcuffs. These handcuffs that can grab on tightly to the COVID-19 virus if it enters the body. What do these handcuffs do? They restrain the movement of whoever is handcuffed. The handcuffs tell COVID-19, look, we know who you are. We know yet that you don't belong in the body. We've come here to arrest you and get rid of you. We've come here to stop your movement in and out of cells. Then the handcuffs restrain the movement of the virus. As handcuffed COVID-19 virus has a much higher harder time going in and out of cells and making more and more copies of itself, that's going to make a difference in the viral load, how much of that virus the person actually has in their body. In order for a person to get sick with COVID-19, they need to be exposed to a lot of viral particles at the same time. They need a critical mass of COVID-19 to enter their body. It's kind of like when you pour water into a cup. The water won't spill out of the cup unless there's too much water in the cup. You need a minimum amount of COVID-19 viral particles to enter your body before you get sick. If a person who has COVID-19 spits or coughs in your direction, as long as too many of those viral particles don't wind up in your airways and mucous membranes, you won't get COVID-19. A vaccine helps prevent a person's body from making too many additional COVID-19 viruses. It helps prevent the body from getting to that critical mass where when the body has so much of that virus, it's just easier to infect others. Think of it in terms of other vaccines. We know that vaccines help reduce new cases of a disease. Think of what happened with measles. Prior to the measles vaccine, lots of people got measles. Then people received the measles vaccine, who still receive the measles vaccine. It's part of that MMR series that it's given to children, and it's recommended as a booster for adults. Guess what we don't see that much more of anymore? Measles in our community. Now, let's say that we stop vaccinating against measles. Would measles come back into the community? Yes, over time. Okay, ready for the next question? What do we know about asymptomatic spread of COVID-19? How much do we know about people not showing symptoms and still spreading COVID-19? Let me tell you a story about Joy, who has seasonal allergies. Joy comes to the house, and she has a stuffy nose and this cough, but she's coming there. She's the babysitter. She was sure that these symptoms were her usual seasonal allergies. Her job has a strict policy that Joy not go to work if she thinks she has COVID-19, but Joy certainly didn't think that she had COVID-19. When she was asked to fill out a questionnaire asking about her symptoms, she minimized her stuffy nose and her slight cough. She lived alone, had to pay her mortgage, and couldn't afford to take a day off work. Plus, she reasoned that she would be wearing a mask the entire time she was there, seeing the child, being the babysitter, that she would be washing her hands, and that she would keep her distance from everybody. Joy reported that she was asymptomatic, but in fact, she did have mild symptoms that got worse a few days later. Joy did, in fact, have COVID-19. Most people who get COVID-19 do develop symptoms of the virus, even if they say that they're asymptomatic. The most common symptoms being cough, muscle aches, feeling feverish without necessarily having that fever. So if you check someone's temperature and they're like 100 degrees Fahrenheit, or you think, it's 100 degrees Fahrenheit, that means that it's too high, they may have COVID-19. There's a lot of people who don't get that fever. There's a lot of people whose temperature is lower. So anyway, the most common symptoms are the cough, the muscle aches, the feeling feverish, the headaches, rashes, nausea, diarrhea, nasal congestion, and potentially a change in taste or smell. Yet if you catch COVID-19, I cannot tell you that you'll be that person who just has a cough and nothing else, or who just has a change in their taste levels and nothing else. I can't tell you that you will be a person with all of these symptoms or just one or two of these symptoms. It varies. I can't tell you how long your symptoms will last. There have been cases of people testing positive for COVID-19 and having symptoms for less than 24 hours. New location, new question. It's now starting to get dark outside because I've been answering these questions, and I've also been trying to take care of my daughter today because I'm not working today. Next question. What do we know about people who have no symptoms of COVID-19, but they still are positive for COVID-19? So this can happen. Again, most people do have some kind of symptoms of some sort, but there are people who have no symptoms. A good group that comes to mind is small children. Small children, like ones that are in nurseries or in daycare centers, tend to not have many symptoms of COVID-19. If they get COVID-19, for the most part, they have no symptoms. There is a small percentage of children who go on to have these blood vessel diseases, which are kind of interesting. I can talk to you more about them later, but by and large, small children just don't tend to have a lot of symptoms. They can still go on to transmit the disease to their families. They still are positive for the disease. Their mucous membranes still have the COVID-19 virus. They could pass it on to others. But there's this belief that if you are more symptomatic, you probably have higher viral loads in your body than if you had if you don't have any symptoms. And we see this play out because these children who are in daycares or in nursery schools and they get COVID-19 don't necessarily always give it to a family member, because that's the concern, is that the school is the incubation spot and then you go home and you give it to somebody at home, like someone who's older who's going to have then more of the symptoms. But these children who don't have symptoms, they're less likely to do that. Now, what is the numbers? Like, how much less likely are there? That's a really good question, and it's subject to a lot of debate right now in the medical community about how likely children are to bring COVID-19 back home to their families, and then the family, the grandparents, the older parents, more likely to get sick. I could do a whole lecture about asymptomatic spread of COVID-19, and it's probably going to take about half an hour to an hour. So I'm not going to discuss it today. Let me know and I can do it some other time. I can just do a follow-up video in a couple days and we can talk about it if you are interested. The next question that many of you submitted was, what, if any, risk is there in getting the vaccine while you're pregnant? So there are potential risks to any vaccine, just like there are potential risks to eating breakfast this morning. You could choke while eating your breakfast, or you could have a side effect to the COVID-19 vaccine. The most common side effect is that your arm feels sore for a couple days after it's gotten the vaccine. Other more common side effects include feeling more tired than usual or developing a headache. Think about it though. Has this last year with COVID-19 felt like a headache in some way anyway? Then you start moving into less common side effects. You could potentially develop muscle pains, joint pains, chills, or slightly elevated temperature after you receive the vaccine. Of those who get the vaccine, about 1 in the 100, or about a penny's worth in a dollar, might get a fever that could possibly be over 102 degrees Fahrenheit. A really high fever during the first trimester of pregnancy could increase your risk of having a miscarriage, of your baby developing some kind of an abnormality. So it is possible, unlikely, but it's possible that after you get the vaccine, you'll have a high fever. If you're pregnant, that could potentially lead to miscarriage or to abnormalities in your baby. But those things are not that common. The risk is low. Most women who have a fever in the first trimester of their pregnancy do not go on to miscarry. Most babies who, as were in mommy's uterus while she was in the first trimester and she happened to have a fever, do not have abnormalities. Most likely, you're going to be fine. However, for some extra cautious women, you might consider waiting on the COVID-19 vaccine until after the first trimester of pregnancy. With regards to what the organizations are saying, it depends upon who you ask. The different organizations have different things to say. On its package insert, Pfizer recommends that you wait until 4 weeks after your last dose of vaccine before attempting to become pregnant. The World Health Organization has recommended waiting 2 to 3 months. On the other hand, the American Society of Reproductive Medicine, who's out there and trying to help mommies to conceive their babies and to have safe, healthy pregnancies. Anyway, that organization is saying that you should get the COVID-19 vaccine as soon as you're eligible. And that's even if you happen to be pregnant at that time. So again, the different organizations, they have different things to say about it, and those organizations may change over time. Now, an interesting fact about the COVID-19 vaccine. Some women got pregnant after they received the COVID-19 vaccine. They were tested when they got the COVID-19 vaccine as part of a clinical trial. They eventually became pregnant. So, what happened to the women who got the vaccine and became pregnant versus those who did not get the vaccine? Well, none of the women who got the COVID-19 vaccine experienced a miscarriage. None of them did. You know, now, we're not talking about millions of women here, but of the women who were tested, none of them experienced a miscarriage. On the other hand, some of the women who did not get the actual vaccine, so they entered the clinical trial, but instead of getting the vaccine, they got like salt water injected into their arm. Those women had miscarriages. Then again, miscarriages just happen, probably more than some of you might think, or maybe not. What I don't want for any of you, if you can avoid it, is to worry about COVID-19 and your pregnancy. So I want you to worry about having COVID-19 and the disease while you're pregnant, because there are risks with getting COVID-19 during pregnancy. Most moms who get COVID-19 during pregnancy wind up fine. Most of their babies wind up fine, but you do have some increased risks of some very serious complications from COVID-19. To remember that COVID-19 is a blood vessel disease. In other words, it affects your blood vessels. It can increase the chances that the structures that provide oxygen and nutrients to your growing baby and remove waste products from your baby's blood, the structures that have the blood vessels in it, the placenta. Well, some pregnant women who develop COVID-19 get an unfortunate circumstance. The placenta detaches from the inner wall of the womb before delivery. The baby is deprived of nutrients and oxygen. If you're not immunized and you develop COVID-19, you are more likely to get this complication when you're pregnant. Sorry if I scared some of you with the last thing I said. It was a little bit blunt, and I'm not here to scare you. And most likely, if you get COVID-19 as a disease while you're pregnant, you're going to be fine. Okay, I'm going to talk about another subject, and it has also to do with COVID-19 and some of the other side effects that can happen when you get the vaccine. So let's do that part. 2 weeks after receiving his first dose of the Pfizer vaccine of COVID-19, a healthy doctor died. He died because of the vaccine. Can the vaccine kill people? At the time of the recording, more than 5 million people have received the COVID-19 vaccine within the United States. Dr. Gregory Michael is the only person who died shortly after receiving the vaccine. Why did he die? He developed a medical condition known as IDP, or Idiopathic Thrombocytic Purpura. It might have had anything to do with the vaccine. Why? Idiopathic thrombocytopenic purpura is idiopathic. That's fancy doctor speak for saying that we don't have any idea why. We think that it might be brought on by extra stress, by a vaccine, a virus, or bacteria, or even what's of the bed that you woke up in the morning. We don't have all the answers. It's kind of like developing cancer. Why do some people develop cancer? We don't know exactly why. It just happens. Anyway, this disease happens to about 1 to 6 per 100,000 adults every year in the United States. They get the idiopathic thrombocytic purpura. The fact that Dr. Gregory Michael developed the condition might have been due to random chance, or it could have been due to the vaccine. And out of the 5 million people, over 5 million people that have gotten the vaccine so far, he seems to have been the only one. But I guess over time we'll find out. Almost 10 years ago, there was a television series that showcased some of the unusual ways that people die. I won't get into all of the specifics in this episode, but let me tell you, every day we encounter potential situations that could result in our death. Most of the time, we do not die. The human body is incredibly resilient. That said, people do get side effects from the COVID-19 vaccine. We discussed some of them already. I also want to talk about some people developing allergic reactions to the vaccine. These are really uncommon. The people who've had severe allergic reactions are the people who've also had severe allergic reactions with many other vaccines. They know that they are going to get allergic reaction because they've had it with other vaccines. But with the medical people do when you go get your vaccine, let's say the doctor gives you a vaccine, is that they're going to have you wait in that office, usually with a group of other people wearing masks, and they're going to have you wait in that office for about the 15 to 30 minutes that would take to get a severe allergic reaction, because over there they have all the equipment that if you happen to get that severe allergic reaction, unlikely chance that you do, they'll be able to treat it so that you'll be okay. Another thing that I run into is sometimes people read articles in other languages from other countries and hear about COVID-19 deaths there after getting the vaccine. So the COVID-19 vaccine related death that happened in some other country. But when you're reading articles from other countries, you have to remember a couple of things. The first thing is not every journal that's out there is the most scientifically accurate. There are some, even in the United States, we have some journals that really are more about just farce. They weren't really not that scientifically accurate. But let's say that this was in a scientifically accurate journal article, which I am kind of doubtful about in this case, but let's say that it was in a scientifically accurate journal. You have to think that in other countries, they're using other vaccines. They're not just at this point using the Moderna and the Pfizer one, they have other ones available. They might be reporting effects of other vaccines. Okay, next question, because you asked this one and I wanted to answer it. What, if any, risks is there in getting the vaccine while breastfeeding? There are several ways to answer this question. A, how should you breastfeed? If you are a mom who thinks that she has COVID-19, is it safe for you to breastfeed? If so, what precautions should you take prior to breastfeeding? B, can the COVID-19 virus be found in breast milk? And C, does the COVID-19 vaccine get into breast milk? I'll try to answer all of them. First, it's important to wear a mask and practice proper hand hygiene when around your baby. In March of 2020, 120 babies were born to mothers who had COVID-19 at a particular hospital system, and these babies were followed over time. What happened to them? Well, in the hospital, the mothers were told, you better wear a mask and wash your hands often with soap and water around your baby. The mothers did that, even though they had COVID-19, and the babies were tested to see if they had COVID-19 too at birth. None of the babies at birth were positive for COVID-19, even though the mothers had COVID-19. Eventually, the mothers left the hospital. Then some of them, okay, actually over about half of them, came back 2 weeks after the babies were born. The babies were again tested for COVID-19. Guess what happened? None of the babies had COVID-19 test positivity. None of them were symptomatic. Why? Because the mothers were told to wear masks and practice good hand hygiene while breastfeeding or while near the baby. Basically, the mothers had to wear a mask. They had to follow all these COVID-19 precautions so they could be by their babies, but they had to be really careful. Now, let's say that you're a mom who breastfeeds while having COVID-19, but does not wash her hands often, does not wear a mask while breastfeeding. In this case, the baby is breathing the same air as the mom. Mom is spewing out virus particles because she has COVID-19 and is not taking precautions to protect her baby from these particles. Perhaps she's a mom who has no symptoms of COVID-19 and does not see a need to wear a mask around the baby. She might test positive for COVID-19, but unless she goes for a test, she has no idea that she has COVID-19. I don't know how often a baby gets COVID-19 from a mother who has no symptoms of COVID-19 herself and is just trying to breastfeed. My guess is that there are currently breastfeeding mothers in our area who have no idea that they have COVID-19 and are breastfeeding. My guess is that all of their babies do not develop COVID-19, but I don't currently know of a study that looked at this very, very specifically. Babies can get COVID-19. In 2020, a health center found 63 babies under 3 months of age who were positive for COVID-19. They asked their caretakers about their symptoms. Most of the babies with COVID-19 had a fever. Less than half had other symptoms. So this is less than half had other symptoms, including a cough, a runny nose, difficulty breathing, poor feeding, vomiting, and diarrhea. Most babies needed to be hospitalized because they had that fever. And when a baby under 3 months old has a high fever, most
people are going to hospitalize them to try to figure out why. Most babies had symptoms. One out of five of those babies wound up being so sick that they wound up in the intensive care unit because they had the COVID-19. I can understand why breastfeeding mothers would want to be vaccinated against COVID-19 as soon as they're eligible to receive the vaccine. If you are a breastfeeding mom and you're thinking about being vaccinated, most likely you will not be passing on the vaccine to your baby. The Academy of Breastfeeding Medicine recently released a statement saying that the vaccine is made up of a very, very tiny collection of fat cells along with mRNA. Because of this makeup, and because the vaccine is directly injected into muscle in the arm, so it's injected into the muscle, is unlikely that the vaccine will travel from the muscle into the bloodstream and move all the way into the areas of breast that make breast milk. However, anything is possible. In the unlikely event that the vaccine gets into the breast milk, guess what will happen? The baby will drink the breast milk. The vaccine will go into their digestive tract because they've drunk the breast milk, not into the muscles where the vaccine does its job. And this, my friends, brings me to the end of this webinar. Now, okay, so who am I? I just probably need to include that as well. I'm one of you. I'm one of your friends. I can't wait to hang out with you. I can't wait for COVID-19 to be over, and I'm just really grateful to be a mom in the community. But I also am someone who has a pretty high degree of education, and I have a degree in epidemiology and biostatistics. I am a physician. I've done a lot of stuff when it comes to COVID-19. Probably won't talk about most of it here because you're just like my mom friends, and I care about you. This is not medical advice. This is my personal opinion. I'm not your doctor. Go see your regular doctors. But just thank you so much for listening to me. Truly, thank you.